Thanks for having me today, everybody. I'm so glad to be able to join. I'm Colleen Stephenson. I'm a dental hygienist by trade. I've been a dental hygienist for about 20 years. And for about 15 of those, I was a dental hygiene professor. So I've done a whole bunch of things with that. And currently, I'm the oral health champion for Idaho from the 100 Million Mouths campaign, which I'm going to talk to you about actually on the next slide. And then I'm also the chair of the Idaho Oral Health Alliance. So that is one update to your slides. I realized it said chair-elect, but I became the chair in January. We've got a great crew over there. All right. So the 100 Million Mouths campaign, I just wanted to tell you quickly about it because you might see it out in the wild or hear things about it and everyone's like, well, what is that? So it was an initiative that was initially launched. Oh, sorry, this is scrolling ahead. Pause for a moment. It was an initial initiative that was initially launched in 2020 under a HRSA-funded Center for Integration of Primary Care and Oral Health. And really, it's supposed to bridge access to care gaps in oral health. So really what it does is it chooses a champion from the group that started it. We have a champion for each state, each of the 50 states. Right now we have 35 who've been trained and supported to date, and then we get more added every year. But we have more than 100 million people in the United States who don't see a dental professional each year for a variety of reasons, and we've probably heard them all at this point. So their aim is really to close that gap by making sure that primary care providers are able to offer oral health advice or education and do exams and do some preventive services or really early intervention type services. And so that's kind of my role. So as a champion, I work with people in medical, nursing, and residency settings, ideally with students is kind of who we aim for, just because any of us who've been trained healthcare professionals know that those things that you hear as a student is really the things that kind of stick with you the most, although continuing education is also important. So I do speak with practicing professionals as well. But what we're hoping is that we can train enough people to actually, start to treat the mouth as part of the body and be able to do these interventions so that we can improve the oral health of 100 million people over the next decade. So it's coordinated by academic professionals from Harvard School of Dental Medicine and UMass Chan in Massachusetts, and we're supported nationally by Colgate-Palmolive. So my work as a champion here is also supported by Delta Dental of Idaho through the Idaho Oral Health Alliance, so that's why I included them in here. So our objectives today are pretty simple. We're going to identify really common signs and symptoms of oral diseases, and we're also going to be looking at risk factors and prevention strategies for those. And then I also, of course, want to link you to resources. So when I make my slides, I really try hard to make sure that the slides are something that we can utilize and have tools in them. So you'll see a lot of different QR codes. I have included one here. If you've missed any of the prior presentations in this oral health series, I want you to be able to have access to them. The slides are available for I think all of them, and some have a link to a recording on YouTube also. So I want to make sure that everyone sees that and has access to it because I think it's important to be able to utilize them. Okay, so for those of us born in the 1900s, such as myself, as much as I hate to admit it, if you've ever seen any of my presentations about oral health before, you're familiar with this movie. Does everybody know what movie it's from? If I had prizes, I'd give them out if you can guess. But I love to share this clip because it really highlights the way that we really practiced medicine and dentistry historically. So in this part of the movie, Johnny Castle, the dance instructor, icon Patrick Swayze, gets baby Francis and Jennifer Grey, aka Jennifer Grey, and he says, "This is my dance space and this is your dance space." And the next line is, "You don't come into mine and I don't go into yours." I might have just flip-flopped those, but that's why I'm not in the movie. So what it really highlights is that we had to keep things separate. We don't go into each other's spaces. We have our own separate things, and we're kind of performing similar things, but they are separate. We don't get into our spaces. And unfortunately, we all know how that kind of has happened. What has happened as a result of that? So where has that gotten us? It's gotten us here. So we still see really advanced stages of disease. And I share this all the time. I wish I could say that these are pictures that we've never seen before. I've never seen a mouth that looks like that. I see mouths that look like this all the time, and I bet most of you have too. And so when we see our separate dance spaces, dental caries still remains the most prevalent chronic disease in both children and adults, despite being largely preventable. And in Idaho specifically, 63% of our children by third grade have had an experience with cavities. And the national average is only 50%. Still not great, but we are above average in that capacity. We also saw almost 13,000 visits to the emergency room for oral health needs. So we have a problem here in Idaho. Really thinking about poor oral health, it impacts every aspect of a person's life, like ability to work, especially if you're kind of like a forward-facing, front of the house type person. Even in some of our more entry-level type jobs, it is really difficult because we treat mouths and teeth as almost like a moral failing if people have mouths that look like these, and that's really not the case. But it can be difficult to get a job or to work. It's difficult for people to speak or to smile, smell, taste, touch, chew, swallow, sleep, and make facial expressions. And so they really have repercussions, not just on the body, but also on a person's mental health. And so we have to treat the mouth as part of the body, just simply put. And it's an important part of the body. We need to treat it as such. So if you think back to our movie, when did things really get spicy in the movie? It's when they started getting in each other's dance space, right? So we've got to do a little bit more to do that on our end. So this is basically what I want on my tombstone. Hopefully not anytime soon, but we have to use words that spark action. And periodontal disease and dental caries are infections that occur in the mouth. And if we had an infection anywhere else in our bodies, would we just leave it untreated? And the answer is no. We would do something about it. So why should the mouth be any different? So I like to use the word infection because it's an action word. It's an action word for us, and it's an action word for the patients that we work with. So the problem with an infection just anywhere in our body is, of course, our immune response in relation to it. And so there are certain diseases that you can kind of see in this graphic. I think it's a pretty decent graphic where we can see the relationship between oral disease and some other systemic diseases. Some of those have a bidirectional effect. So like the most notorious for that would be diabetes. People with poor diabetic control typically have advanced periodontitis, and people with advanced periodontitis with diabetes oftentimes have difficult times getting good glycemic control. So they really have a bidirectional effect with some of those types of diseases too, and definitely a relationship with everything else because our mouth is connected to the rest of our body. So in America, more people are likely to visit a primary care provider than they are a dentist. And so the primary care setting is just a more reliable source to get oral health care. And again, the mouth is part of the body, so it really is something that should be included. Oral health care is primary care. Additionally, in Idaho, only about 37% of our needs are being met because 452,000 people, over 452,000 people live in a dental health professional shortage area, a dental HIPSA. So we really have to work together. We have to be treating these as infections. We have to be proactive, and we have to be prepared to act if we do encounter early stages of disease. So education is really the first step of this, and that's why I appreciate everybody being here. So how are we going to start, right? I think the first thing is like, well, what can spark a conversation? Maybe between our colleagues, maybe with our patients. So these are just some examples of oral health in the news that I felt were interesting, and these were just easy things to kind of search. So I've linked them here if you want to look them up yourself. But what I think is kind of telling about some of them is that they could be something that might spark the interest of our patients, or you could be talking to our colleagues like, hey, did you hear 4 out of 5 stroke patients have oral bacteria in the blood clots? Blah, 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 blah. And my favorite one, of course, is the very one at the bottom, erectile dysfunction linked to poor oral health. That gets our male patient attention, and sometimes our female patient attention as well. So we are getting more information and more research all the time, but these are some things that we can use to kind of start those conversations, like I said, with our colleagues and with our patients. So I think what I hear the most is that with our primary care professionals is like, okay, that's all fine and great, Colleen, but like, where do I start? And so it starts with education, and it starts with having these discussions. And then there's actually frameworks that are already in place. So this one's from Qualis Health. It's made for medical providers. It initially focused on FQHCs, but really anyone could use it if you so chose. So it just asks you to do some really basic things. So the first thing is like ask about any types of oral disease or risk factors, signs and symptoms, things like that. It asks you to look in the mouth. I wish I could say that everyone is doing that, but in my experience, that hasn't really been the case. Or what I've also heard from some of my medical colleagues is that they're like, yeah, we look, but like they look right past the teeth into like the oral pharynx. I need you to look at the teeth. I need you to look at the tissues. And then depending on what we find, we have to decide how am I going to respond to it. And then either do some type of intervention, education, or do a referral for further treatment. And then, of course, document everything. We know documentation is important, and it also helps us to kind of see where those gaps are. So I've linked this with the QR code as well, if you wanted to learn more about this particular framework. And I have some other resources at the end as well. So just like our old adage says, an ounce of prevention is worth a pound of cure, right? So the best time to find any type of issue is before it becomes an issue. So we want to look inside the mouth and look for just really obvious signs and symptoms of infection. So I'm going to look and see, am I seeing things like bleeding gums? Am I seeing any type of swelling or inflammation? I'm going to look if there's any loose teeth or holes or really obvious things. Like that picture we had earlier, some of those things are really obvious to see. And so we want to make sure that we're looking for them. We also will ask questions like, hey, how often do you brush or floss? Or how frequently are you snacking? We want to ask about things like liquid sugars or acidic drinks, things that people don't always think about. They're like, oh, I haven't really been eating, but then I've been sipping on my Diet Coke all day, things like that. We want to ask something like, when's the last time you saw a dental provider? And really discuss with them why oral health is important. You know, we kind of take the lead on these things. So if we are taking an active role and speaking to our patients about it and showing them that we think it's important, then they are more likely to treat it as something that's important. So in order to do that, we need to know, first of all, like, what is a healthy mouth, right? What does it look like? And I think we all have a pretty good idea of it, but basically these are the things that we're looking for. So the first thing is a healthy mouth has no untreated, It has no untreated disease, no tooth decay, no evidence of lumps, bumps, ulcers, no weird discoloration on the tongue, cheek, or gums. Those could be signs of oral cancer or an infection or all sorts of things. So we want to look first at the tissues. That would be like the mucosa inside of the mouth. Is it moist? Does it have adequate moisture? Do we have a specific smell? It needs to be odor-free, and it shouldn't be hurting at all. When we look at the gums, we want to make sure that the color is appropriate. So the interesting thing about people is that this can all vary between patients. So I put a few different pictures here to kind of highlight some of the differences we might see. So gums kind of vary in pattern and color between people, but generally we want them to be coral pink. Sometimes we will see some that are heavily pigmented. So like this picture, it's on my left. And I don't know if you can see my cursor, but it's melanin pigmentation. That's normal. And we usually see that in people with more melanin in their skin. This would be totally normal, nothing to write home about. And then this picture on the right, that's kind of that pink tissue that we would normally see. The tissue should be firm. It shouldn't be red. It shouldn't look swollen. And number one, it should not bleed when they brush or floss. So if it's touched, it shouldn't be bleeding. If I was like washing my hands and my hands started bleeding, I'd freak out, right? But with our mouth, for whatever reason, we're like, oh, my gums always bleed. And that's really not a healthy mouth. And then when we look at the teeth, we want to make sure they're firmly attached to the gums and to the bone, and it doesn't hurt them to chew or to brush. Those are pretty simple things that we can look at. And we want to make sure that our patients understand and that we understand that a healthy mouth and really functional teeth are important at all stages of life because they help us with breathing, speaking, eating, in the works. So I also included those pictures of a healthy mouth, and then these are pictures with some common oral findings that you might see. So I have a few different examples of gums. So in picture number one, does anybody see anything wrong with this picture? It's actually a pretty good mouth. Their gums look great. There is a little bit of white spot lesions that you can see here, but they look like they remineralized. So you kind of see some of this little white spot along the gum line in a few different teeth or kind of in between the teeth. That could be signs of demineralization, which is like the earliest stage of a cavity. But in this mouth, most likely it has remineralized and then it just kind of leaves a little bit of a scar. So actually number one's a pretty good healthy mouth. Number two would be an example of a benign tumor called a pyogenic granuloma, really common when hormones are high. So we'll see it in like pregnant patients, and it won't go away until they're done breastfeeding. Sometimes it needs to be excised or removed. On this one, number three, we can see the gums are puffy. We can see some of that darker staining. That's, again, possibly some remineralization or some demineralization. It's hard to tell without looking too closely. If it's kind of like a chalky color, then it's usually active demineralization or early decay. When it is that's stained or kind of shiny over it, sometimes it can be a tooth that's remineralized. And so it's hard. Again, we don't really have to do anything. The cavity started. It just depends on the individual, but those are the types of things we want to look for. And then these ones on the bottom, you can see a variety of different gum issues with the swelling, the redness, and this one in number 6 is some erosion. So if I see some of these things, especially like 2 through 6, you might make a referral to a dental professional. And then kids are kind of similar yet different from adults, as we all know. So baby teeth sometimes look a little bit different. These are examples of healthy baby teeth and gums. So you can see that there's really no deviation in tooth color or texture. It's smooth. There's no roughness. We don't see any swelling or bleeding. If we do see kids that have some type of enamel defect, so like the enamel didn't form properly either on their baby teeth or their permanent teeth, those teeth are more susceptible to decay. And we know that that's the most common disease of childhood. Like 60% of kids will have at least one area of decay between their 12th and 19th birthday. So we want to make sure that we're looking for those type of things. I actually have in both of my children, they had enamel defects in their first molars. So I am living that dream as it is and really watching it carefully because we're at high risk. They're at high risk for things. And the reason that we're worried about things like that in the permanent teeth and really especially the baby teeth is that these baby molars will be here until they're about 10 to 12 years old. So they're here for a long time. And we want to make sure that we're able to be looking for signs of disease and be able to treat it adequately. This is an example of early childhood caries. You can see early stages of disease. So on this previous slide, I'm going to go back really quickly. Looking for white or brown spots, any roughness or cavitation, that could be signs of early disease. So I like this picture of a baby's baby teeth because you can see that you're like, if the average person looked at these, you might think, oh, they don't look too bad. But you can see some of that white demineralization along the gum line. You can see like a little hole in this one here. I'm not going to tell you the tooth number. They're alphabet letters when they're baby teeth. And then the gums look a little bit swollen, a little bit of redness along the gum line too. So a little bit more subtle in this picture, but I like to show it to you because a lot of people think, oh, that doesn't look too bad. But when we talk about early childhood caries, you know, in those advanced stages, like if I saw a child with black teeth in the front, of course, I know something's not right, but there's lots of different stages of it. So the little bit more subtle, I think by looking at more pictures, you can see the same types of things. So again, looking for those white spots, maybe a little bit of that lighter brown discoloration all the way to black and potentially teeth missing. So we want to avoid that if at all possible. Baby teeth are important. They hold space in our mouths. They help with speech development. They help with all sorts of things. So baby teeth are important. They do matter. Yes, we're going to lose them eventually, but they hold a purpose while we have them, and we want to keep them until it's appropriate for them to be lost. Otherwise, we need to have some other different interventions, working with maybe an orthodontist and their general dentist. So I included this whole slide that has oral health considerations for patients, for children and adults. And there's literally everything on here. Like I mentioned, I like my slides to be useful. I want it to be something that you can refer to and have more information. So I'm not going to get too in the weeds with literally everything, but I want to highlight some things that I think are really important when we're focusing here on kind of our best practices with prevention. So first thing is with that risk assessment, I want to make sure that I am looking at the individual risk status. So I believe our previous presenters talked about CAMBRA, which is Caries Management by Risk Assessment. And essentially it looks at your risk for getting disease and then has really specific evidence-based guidelines about recommendations that can be made when we talk about cavities. But with a really young child, we'd be looking at their parents' disease status. And then as they get a little bit older, we're looking at individual status, and definitely for adults, individual status. What I really want to highlight is that the bacteria that causes cavities is transmissible, which means we can give it to each other. And we want to find ways to try to reduce that. So especially when children are young, we can share bacteria by blowing on their food, sharing utensils or straws, sticking the binky in the mouth to clean it off. I personally think that's disgusting. But as far as like not blowing on their food and not sharing utensils, as a parent, I just did not find that realistic. And so what would be important in that type of a situation would be making sure that the parents' oral health is adequate and we're reducing their bacterial load, so less likely to transmit that bacteria to their kids. And then when our kids get a little bit older, you know, a good thing you can talk to them about is that you can also share that by kissing. So I do like to kiss my babies on the mouth, but I liked it when my babies were a little bit older and I would remind them that you can share bacteria that cause cavities by kissing. I don't know if it stopped them, but fingers crossed. We will look at other things too, like parafunctional habits. So if they're like clenching or grinding or things like that, we want to make sure that we're looking at things like airway. That's something it's not new in dentistry, but it is newer. And so something we're looking at and orthodontists are looking at to make sure the airway is adequate. It is a deep hole that I won't dive down because there's so much information about it, but something you could look into further. And then these ones on the right, diet, oral hygiene, and fluoride are the ones that I want to spend more time on. So here's just kind of a general list for you. I did create a little link that talks about fluoride, a QR code for more about fluoride, because basically fluoride has really gotten a bad rap. And I feel like it's really ramped up in the last year or so. And so I want to make sure that we are looking at the latest evidence-based guidelines and looking at who supports things like community water fluoridation or supplementation and things like that. So I'll dive into these just a little bit further in the next slides. So when it comes to diet, we all I feel like we're being bombarded all the time about like what's a healthy diet. But when it comes to our mouths, there's certain things that we need to know. So the first thing you got to understand is how a cavity actually forms. So for a cavity to form, we have to have a susceptible tooth surface, which means it's not as strong. It might be more prone to cavities. It could be a tooth that maybe did not have fluoride as it was developing. Anybody who's been in dentistry, you can usually look in somebody's mouth and say, I'm from Southeast Idaho. We do not have community water fluoridation here, and we really don't have any fluoride in our water. So I can tell somebody who did not grow up from the area, usually by the first time I've met them, and it's because they just don't have cavities, like the people that I'm used to seeing here in the area. So the susceptible tooth source would be a tooth that is already has some demineralization or didn't have enough enamel, or had a difficulty with the enamel formation, like an enamel defect, like we talked about, or it's just been exposed to acids, all sorts of different things like that. So we'd have a susceptible tooth surface, but I should also mention though, all enamel is eventually susceptible. So that's why we have to use these other things to kind of balance it out. But we have to have the susceptible tooth surface. We have to have the bacteria that cause the cavities. And again, which are transmissible. Usually we get them from the children. And then we have to have a sugar source for the bacteria to feed off of. And then we have to have time. So this is a disgusting analogy, but I'm going to use it because what I find is that it works great for middle schoolers, and actually it works for everybody because it makes sense. So basically the way a cavity forms is we have the bacteria that are on the tooth, it eats the sugar, and then what happens after we eat foods? We produce waste, right? So basically when somebody says bacteria are pooping acid on your teeth, I'm like, that's gross, but also that's kind of what they're doing. So I think it's a good analogy to use because that's basically what's happening there. So when we are looking at that, and as the acid sits on the teeth, that's what causes the cavity. So if we can do something to kind of break that chain, that's going to help. So that really leads us to mentioning that pH is super duper important, the pH of the mouth. We want our mouths to be neutral or basic if possible, but every time we eat or drink anything, the pH in our mouth drops, and it takes about 20 minutes for the saliva to do its work to kind of like neutralize those acids. So when we're talking about diet, we're not just talking about what people are eating, but how frequently they're eating. So we want to make sure that if they're going to have, I know we're all guilty of something like this, where like somebody made cookies, for example. I was like, these are delicious cookies, but I just want a little nibble. This actually literally happened to me yesterday. It wasn't cookies. It was a Rice Krispie treat. And I was like, oh, it had like fruity pebbles in it, which I thought, oh, I don't think that's my jam, but I wanted to taste it. So I took one little bite and I was like, I don't know if I like that. I took a second bite and was like, it's okay. But then I set it down. I closed it up. Then I went and I did something else. And then as I came back through the kitchen, I was like, maybe I need one more bite of that. That was kind of good. I take another bite as I go in. Pretty soon I've eaten the whole thing. Finally, about halfway through, I was like, you know what, finish it. And I did. And that's what I had for dinner. And it was fantastic. But I did basically the worst thing for your teeth, which is every time I took a bite, the pH in my mouth dropped, and then it takes about 20 minutes for it to go back up. So my saliva might be working extra hard to try to buffer those acids that are produced every time I take a bite of something, but every time I take another bite or a sip, it drops again. So if you're going to have the Rice Krispie treat or the cookie, eat the whole thing and be done with it. Or I'm going to be eating lunch. I'm going to have my sandwich and my cookie and my delicious Diet Coke all at once and be done with it instead of sipping all day. Now, I am going to take a sip, and I want to be clear. This is water in my Sonic cup, but sometimes it is Diet Coke, so don't judge me. It's a balancing act, okay? So with our pH, it's really important to look at that, making sure we're talking about liquid sugars. I think they're sneaky, and I think people don't think about them. So even like a flavored water is often acidic. So really just plain water is our best bet. Milk, especially with our little kids, is something important to consider as well, because with the milk, it also has sugar in it. And so that's why we don't put kids to bed with a sippy or anything but water in that sippy cup. With the diet, we really want to make sure that we're talking about things like protective and detersive foods. So protective foods would be things like nuts or cheeses or leafy greens that are really high in nutrients, high in calcium or vitamin D, phosphorus, things that strengthen our teeth. Those are important for people to have. And then the detersive foods, and they're healthy for our teeth and gum, or they're best for our teeth and gum health, I should say. And then when we talk about detersive foods, those are teeth that naturally clean our teeth as we eat them. So that would be crunchy foods like apples and carrots. And so they kind of cleanse and stimulate our gums as we eat them. So they're really just doing double duty for us. And so even though there's a little bit of sugar in them, like the pros outweigh the cons with those. It is important to note that chips do not count as a crunchy food. Those would be something that breaks down into a sugar. So I like to warn people about that, even though I also love a chip. And then also when we're looking at foods, and if we're talking with like parents and teenagers, and honestly, even adults, is looking for foods that we think as a population are kind of like a healthier choice when it comes to snacks. So I have a kindergartner who plays sports, and I've always noticed when we play sports, the treats are key. Although luckily we're on some teams where it's not as important anymore. But when you've ever been on like a child sport team for recreation, they usually are bringing treats every week. Somebody's bringing a drink and a treat. And what are the treats that we think are just like a healthy little treat? They'll bring things like granola bars or fruit snacks, or they're like, this is real fruit leather, like a dried fruit. Those are horrible for our teeth because they're sticky. They have sugar in them or break down into sugar, and then they're harder to get out. So it doesn't mean that we can't ever have those treats. And in fact, I'm the queen of the treat. I will bring them a great treat, but then I also throw a toothbrush in with it. So I know that this is a treat. This isn't like what we're eating all day, every day, throughout the day. I'm trying to choose foods that if I'm going to have that little sugared sticky treat, that it's something that is a little bit better for I'm having it with a meal, or something better for the teeth, or I'm doing something to kind of combat that after. So maybe they can rinse with water afterwards or chew sugar-free gum or something like that. So I like to point those out. And I did also want to say with sticky and hard foods technically can physically damage the teeth. But actually, if I had $1 for every time somebody broke a tooth and told me they were eating a sandwich, I'd probably have at least $10 to buy a coffee, maybe more. So just things to be aware of. I don't really care what they're eating, as long as they're being mindful of the timing and choosing things that might be better than other things, and making our baby steps along the way, right? So making those tiny swaps. So when it comes to oral hygiene, that's what we get asked all the time. Like, okay, so what should I do for my mouth, right? So what is there that I need to select from? These are the questions I get asked all the time. So like toothbrush. Which one's better, an electric toothbrush or a manual toothbrush? Does anybody know the answer to that? Oh, Dr. Erickson does. The answer.
I was going to say the one that you use.
That's absolutely the right answer. So a manual toothbrush is fantastic. An electric toothbrush, in my opinion, even better, just because it kind of does the work for you. No matter what one I'm using, my technique needs to be appropriate. And most people aren't using the correct technique. So you want to make sure they're brushing toward the gums at a 45-degree angle. And then there's a few different varieties depending on their oral conditions. But whichever one you're going to use is the right answer. So I just like electric because I feel like we live in a society, myself included, where like, let's work smarter, not harder. So if I can do anything to make life easier, that's what I'm going to do. And everybody in my family now has a power toothbrush. It was a little hard to get my husband on board. But what I did is I just stole his manual toothbrush and put an electric one in there. And I haven't heard a peep about it since. When it comes to toothpaste, which toothpaste do I choose? There are 1 million toothpastes on the market, and they are marketed to the hilt. Oh, excuse me for 1 minute. Let's go back to toothbrushes. Whichever toothbrush you're going to use, and also making sure you use soft brush head, soft bristles or soft brush head. A lot of times it's difficult to know what you're getting. A lot of people will pick like a medium or a hard because you think it's cleaning better. Again, that's not the truth. It comes back to technique. Okay, so now with toothpaste, which one does it really matter? Not necessarily. I'd like it to be a fluoride toothbrush or toothpaste, excuse me, just because our teeth need that fluoride to help remineralize. There are toothpaste with like nanohydroxyapatite in them, which is what helps to form our teeth, and those are showing some good research as well. I don't have the time, and so I won't spend the time to dive too deep into that, but I want to make sure they're using something that helps remineralize, and sometimes we need kind of a combination of those two things. When it comes to toothpaste, so I have this no on here. It doesn't mean don't use toothpaste, but what it means is we don't need the Aquafresh swoop on there. That's too much toothpaste. First of all, in this economy, who can afford it? And secondly, that's just too much toothpaste. We just don't need it. It's wasteful. So you just need a pea-sized amount. Everybody should be using a pea-sized amount of toothpaste. That's all you need. And with our little kids under age 3, they still recommend a fluoride toothpaste for them, but just the smear the size of a grain of rice, because that way, if they swallow it, it's not going to make them sick or be too much fluoride, because too much of a good thing isn't always wonderful, and too much fluoride can be problematic. So we need to be cognizant of that. When it comes to cleaning in between the teeth, floss isn't the end all be all. Most people are like, I hate flossing. I'm like, super. What else could we get to use to clean in between? You actually kind of want to use whatever fits the best. So some of us with larger spaces between our teeth, floss really isn't it. There's other things that are available, like little picks, brushes, and things of that nature. I get asked all the time, are floss picks okay? Floss picks are great. Again, it comes down to technique. With those, anytime I floss, I want to try to wrap it around the tooth in a C shape. So with with like string floss, I can use my fingers to kind of do that. With a little flosser, like the horseshoe shape with the stick on the end or the toothpick on the end, I just kind of push against one tooth, go up and down a few times, pull against the other, and that works great. And also I tell people to use them while you're doing something else, like reading a book or a magazine, watching TV, scrolling Instagram or TikTok or whatever, something that you'll do. I keep some in the car. I don't recommend that people do distracted driving, but if you're kind of in there being mindless and you feel like you're stuck in traffic, go ahead and get in there and get those things done. So just do something to clean in between your teeth, because your toothbrush doesn't reach. And even if it is not as critical for cavity prevention, which there's some different research on that, it is critical for gum health, and your gums are just as important as the teeth. We got to have something solid in that foundation to hold them in. And then mouthwash, is it really necessary? It just depends. Different mouthwashes, some can kill good and bad bacteria. So you really want to look at the effect of it. Is it something where the benefits outweigh the risks? And then if we do need an antimicrobial mouthwash, make sure it's an antimicrobial mouthwash, not one that just freshens our breath and just makes it smell good for a few minutes. Let's go on to the hot stuff, fluoride.
There's a question in the chat, if you don't mind, like answering it.
Oh,
I can read
yes,
it.
let me scroll. Oh, what do I think about the oral little brushes that go between the teeth? I love them if they fit. So the biggest thing is when you're cleaning in between the teeth, you don't want it to be one that you have to force in between, because you can kind of blunt your gum tissue and then make kind of a bigger space theoretically. I mean, it's really relates to the bone as well. But like I said, the biggest thing that fits without forcing is the best thing that cleans. So I love a little, we call them proxy brushes, or I really love a soft pick. They're like the white ones with the green tip. I love those ones for my mouth. I have larger spaces between my teeth because I have advanced periodontal disease as a dental hygienist. I just have a lot of bone loss for a variety of reasons, but those are great. So anytime you have questions about like, hey, what's the best thing? Again, it's the thing that somebody will use. So I do think in my years as an educator, sometimes we'd kind of get lost in the weeds, like this is the best thing for X, Y, and Z. But things like a water flosser back in the day, like a water flosser was just like, it wasn't it. It just did not do enough. And now we're seeing great research with water flossers, and actually people are using them. So I'm like, whatever you're going to use works for me. So something to think about too. Great question. All right, so on to fluoride. There is a lot of anti-fluoride rhetoric, and I think it's really important when we talk about fluoride to focus on the difference between topical versus systemic. So a topical fluoride is one that goes on the teeth in the mouth after they're already in the mouth. A systemic fluoride would be something we would consume as the teeth are developing. So whether through community water fluoridation, which we really just do not have in Idaho right now, or supplements, like my children use supplements. Now, supplements are still recommended by the American Academy of Pediatrics and the American Academy of Pediatric Dentistry. And actually, it's still on the U.S. Preventive Services Task Force guidelines as well. I looked all of this up. I was scared for what I was going to find, and it's all still on there. So I would, in this case, go with the experts on this, which I say is the people taking care of our kids. So we want to make sure that when we're talking about fluoride with our patients, there are a lot of people that are not pro-fluoride for a variety of reasons. It can be toxic in too high of a dose, and it can cause things like fluorosis if we again, have too high of a dose. So it's really important to follow the recommendations with supplementation, looking at how much is in the water. So my pediatrician initially was not prescribing fluoride. And I called about it and I was like, hello. I just left like the 6-month appointment with my youngest. And I was like, this is Colleen Stephenson. And I left a message with this nurse. I would like Dr. Larson to consider prescribing fluoride supplements. I would like some myself. And if he's not doing it, I'd like him to do it with everyone. And thank you, goodbye. And they called me back and said, oh, he's going to do some for you. But I said, well, I'd really like him to do it for everyone. So just think about it. And they're like, okay. They're probably like, this lady again. But guess what? He does it for everybody now. And he has dove in. He looked up our water fluoridation in Pocatello and in the different areas. He uses My Water's Fluoride, which is this QR code right here. I linked it here. You can look and even put in like your address and see what water system it's on and how much fluoride there is, so that if you do need supplementation, that it's appropriate for the amount of fluoride that's in your water, either naturally occurring, which is usually the case, or if you're on a community water system and don't need it, things like that. So a really great resource with that one. And then this lower QR code I included here. This is from the American Academy of Pediatric Dentistry, and it's their best practices guidelines. So talking about fluoride in all different forms. So when we're talking about fluoride with our patients, I'd say from primary care providers, supplementation's big. As the teeth are developing, we start it usually at 6 months, and it can go all the way up through 16 years of age. We want to consider all sources of fluoride when we're looking at that. It's important for the systemic as the teeth are developing. Now, our topical fluoride, once the teeth are in the mouth, most teeth would benefit from a little extra. So that's why we can use like an over-the-counter toothpaste. If we've done our risk assessment using that Canberra guideline, the caries management by risk assessment, if they're a high risk and they're 6 years or older, then we want a 5,000 parts per million fluoride. And let me just tell you, I believe in it. And I'm going to tell you why, because I've seen it in my own mouth. I used to get cavities all the time, even though I know the risks. Again, usually this is Diet Coke. Okay, no judgment. But even with my own kids, I saw early cavities on my oldest son. He's 21 now. And I was horrified. I was like, oh gosh, I'm dental hygienist and my kids got cavities. So I got him on a prescription strength fluoride. And the next time we took x-rays, they had basically all remineralized. And there was one that had looked like it gone all the way through the enamel and needed a filling. And then they went to drill it and they're like, it's hard, Colleen. I'm not going to touch any of the rest of them. So I've seen it. I believed it. And then I also actually got a look at his little teeth. He had them extracted for braces. And I actually kept the teeth, and one got cut in half, like just perfect, like a perfect specimen. And I kept it in a little thing in my drawer in a baggie so I could show everybody. But you could see exactly where that cavity had started and exactly where it had stopped and remineralized. And halfway through the enamel, it was a perfect specimen. I should put it in books because it was such a good one. So I do believe in it. I've seen it myself. I've seen it with my children. And so follow those Canberra guidelines, okay, especially with the fluoride. Fluoride varnish is also beneficial. That's part of our Canberra guidelines. If somebody's a high risk, every 3 months. So when you're seeing your little kids and we're seeing them in pediatrics, then we want to be seeing if they're getting some from the dentist. I will say this, because it's a topical fluoride, what I've also heard is it can be difficult. Like, did they get the fluoride at the dentist? And then do I give it again at the physician's office? Like, how often is everybody going in? How often is everyone doing it? Well, with fluoride varnish, if I did it today and tomorrow, it's not going to hurt me to do it today and tomorrow. I don't want to do it today, tomorrow, the next day. But if I did it like right back to back, it's not really going to hurt anything. It's not going to help anything, but it's going to be just fine. And so if in doubt, I say pop on that varnish. And then the last thing will be the silver diamine fluoride, which I have a slide about here too. So the silver diamine fluoride, we just got a code for it in 2023. There's a training in Smiles for Life. I have a slide about that coming up as well. But the fluoride varnish and the silver diamine fluoride are things you can do in office, and at least the fluoride varnish you can be reimbursed for. And the SDF, they're working on reimbursement, if not already. It just depends on the payer. So this is an example of silver diamine fluoride. I apologize that I only have pictures of little children's teeth because it's not just for kids. It really is great because it can buy you time. So the places that I find it to be the most beneficial is, of course, with kids, because we know eventually they're going to be losing these teeth anyway. But I also find it very helpful when I'm working with older adults, especially in like some type of care facility. Extremely difficult to transport sometimes. And so this can at least probably keep it from progressing, or if I need to use it in anyone, it's to buy time. So maybe they can't get into the dentist right away, but I don't want this to continue to progress to the point where I'm going to lose the tooth or end up needing a root canal or something like that. So I can use the silver diamine fluoride and kind of buy us time, regardless of the population I'm using it in. It doesn't work on every tooth every time to do that. Sometimes it's just too far gone, but most of the time it at least slows it down, if not stops the decay completely. But as you can see with the picture, it's not without its own downfall, which would be the darkening. So once that it's applied to the decay, then that turns black. People are very worried about cosmetics, so you really need to make sure you have appropriate informed consent. But one thing I do want to bring to your attention is the people that I see who have advanced decay that need this type of thing, especially in like the care facilities, guess what? Their teeth are black anyway. Black with decay. So it's something that you really want to look at and consider, and don't just write it off. It has a little bit of a learning curve, but it actually is easy to do. And there's training in the Smiles for Life curriculum about it. And I am working on, with my 100 Million Miles campaign, we're working on trying to get people connected with a dental professional who can kind of like give you a soft training, a hands-on training with it as well, because that's something that can be intimidating if you're like, I've never done this before. It's nice to have somebody who's like, let me walk you through it. So that's kind of our quick and dirty with an overview of kind of best practices, things you can think about. Like I said, I want you to be able to use my slides, but I also want to make sure that you have other resources so you can learn more. This is a link to the 100 Million Miles campaign. So this big QR code at the top is the link to the 100 Million Miles campaign. On that link, you can find our curricular resource, is what we call it. It's called Fillings, Bits, and Bites. And it's just like a little newsletter that has little oral health topics and kind of talking about how they relate to some type of systemic issue. And then we also have a little focus. It always includes oral health from an equity lens, because health equity is sometimes equity seems to have become a bad word recently, but at the end of the day, equity is important and equity does matter. And so we always try to look at things from an equity lens. The other thing that is on this bottom QR code, that's a link to an article from the Journal of the American Medical Association. It talks about how addressing oral health needs actually lowers annual medical costs. And then the last thing I want to show you, or one of the last things I want to show you, is a few different online resources. So this one, that's the AAP fluoride use. It's from the American Academy of Pediatrics, and it links kind of like best practices with all of those types of topics with fluoride and children in particular. We also have links for the Protect Tiny Teeth. It's like a toolbox you can use. It's worth checking out at least and looking. And then this big QR code at the top is my secret that I'm sharing with you. I'm actually terrible at keeping secrets. I share this with everyone. So if you're like, hey, how do cavities form? It's my favorite little TED Ed video. Anytime I go and speak to adults or children, it is a cartoon, or it's like animated, I should say, but it is usually there's something I don't like about them. Something's not accurate and what have you. This one is actually accurate and it's incredible. It's on YouTube. So I always Google TED Ed Carrie's video. I show it to my kids. I show it when I do presentations. It's about 5 minutes, but if there's like wait time, or you want something to play in the waiting room or something like that, or you're like, hey, you're going to be in here, you can have the nurse pop it on and then off you go. And then by the time you come in, they've seen the little video, something like that. Just things to consider. Or you could have the QR code, mom or dad could scan it and they could watch a little video. And I don't know about you, but my kids go ham my little guy goes ham for a video, right? So that is my favorite resource when you want to learn how a cavity forms and you want people to learn how a cavity forms. It's great. Like I mentioned, Smiles for Life is a great curricular resource. They have an app, And they also have a website. So on this app, they have all these different references. Oh, I saw, where do we find that video? It's on YouTube. So it's a TED Ed Carries video, or you have access to these slides so you can scan the QR code and it takes you right to it. That big QR code on the previous slide. Smiles for Life is one you can just download. It's in the App Store, and it has all sorts of things that you can look at. Like it looks at oral conditions. You can do like sample cases. It does the silver diamine fluoride screening. That's fairly new within the last couple years. So it looks at a risk assessment tool. It has all sorts of great things for you, and it is made for primary care providers by primary care providers with help from, of course, dental professionals. So really a great resource for you, and one I don't get paid by them by any means. Full disclosure, I don't get paid by any of these things. These are just things that I love and like to use. And then just to wrap it all up here at the end, I just want to point out a few things, which is that I want you to start using the word infection. I want you to treat periodontal disease and dental caries as infections, because they are. And then when we look at our best practices for preventive care, I want you to take a look inside the mouth. Even if you're like, I don't know what I'm looking at, guess what? Well, the Smiles for Life app will help you. They have some examples for things that you might find commonly, but also look for those things. Look for swelling, look for inflammation, things you might look at in the rest of the body as well. Take a look inside the mouth. Ask questions like, when's the last time you saw a dental provider? Do you have anything that's hurting or bothering you? That's one of the first things I ask when I see anybody. You can dive deeper and ask about things like diet or oral hygiene habits and things like that. Talk to them about why the oral health is important. Again, these are infections. Use the word infection. And then ideally, we'd like to see a referral system established. I will put in a plug. So one of the resources I linked on there was CareQuest. So CareQuest actually, and by the way, my previous slide with all like the logos on them, they're hyperlinked, which you won't be able to access the way you have slides, but I have my contact information coming up. So if you'd like me to send you that slide, so you could just click and go, or you could just Google them. Either way, I'm happy to do that. But CareQuest, which is one of them, has great webinars all the time. They really focus on health equity. It has an oral health focus, and they have a webinar about like closing that referral loop. And so if you're looking to establish a referral system, you can do that yourself, or you can see how others are doing it. And these are things that we can try to help you with as well. This is something the Idaho Oral Health Alliance has been working on. COVID shut us down, but we're trying to get that started back again. But we've had I say we as like a society have kind of had other priorities when that hit, but we're trying to get back to it. And then of course, last thing is please reach out. I'm happy to answer questions or connect you with resources. I like to play Who Do You Know? I like to play, I say that I'm the Kevin Bacon in Pocatello. So I know everybody, or within 6 degrees. I can connect to everybody within 6 degrees. Because if I don't know the answer, I'm happy to share you with somebody else who does know the answer. So please reach out. And a huge thank you to the funders for Echo Idaho, Delta Dental, MCNA. They run our Medicaid contract in Idaho. Of course, the Idaho Oral Health Alliance. I am a little bit biased, but the Idaho Oral Health Alliance is my love, and I've been involved with them for a lot of years. It's a nonprofit, but that's really how things are moving forward here in Idaho with oral health, and how things like this are being coming to the forefront. And then of course, Pacific Source. And then here's my contact information. This is one of my emails. You can reach out to me, and I'm happy to answer any questions. I'm going to just double check on the chat. Thank you, Casey, for the heart. Oh, somebody sent the link. Thank you very much for the video. Please watch it and think of me. And if you have some popcorn with it, be sure to floss afterwards. Does anyone have any other questions? Hopefully that wasn't too fast and furious for you. I'm a fast talker. But like I said, please reach out if there's any more questions. We just want you to look, and we need to collaborate. We don't even have to dance.
Thank you so much, Colleen. That was perfect. It was great. In the meantime, since this is our last session, I would like our panel to close us out with a few pearls to take with us as we're closing out this series. So, Jamie, if you could start us off, and then we'll go to Erica.
Ooh, I love being put on the spot first. I think that this course in general has been amazing, and I am so honored to be a part of it. There are too many pearls for me to give specifics, but I think the general idea that cavities and our oral health is similar to a systemic disease, very much like diabetes or heart disease. And we want to treat those things and take them seriously. And there will hopefully not be like societal down look on people who suffer from those things, like there are with other diseases. I think together we can make that stride and hopefully make easier access to patients when they are willing to come and talk to us about it, and hopefully not feel ashamed because of the state that they're in, and really like, we are here to help you. This is a medical condition. Let's figure out where your risk factors lie. Let's talk about things like diet and nutrition and all the other things that may be impacting this, genetics, um, biofilm, bacteria, all of it, and move forward kind of in a team approach. So thanks to all of you, all the primary care providers that have been here, amazing. If anyone has questions after this, to feel free to reach out to me. If I can be of any help, I'm happy to collaborate.
You again. It's great to have initiatives like this. I think what I want to say is for you medical providers, the more you can talk about oral health and close those silos and those dancing spaces into one, our patients look up to you. And when you make that connection of their oral health being related to their overall health, they start making it as well and giving oral health the value that it deserves. So please keep bringing up those conversations. I think that's the most important thing.
Perfect. We'll go on to Casey.
Yeah, it's really been a pleasure to work with you all over the course of this series. I think the points that have been made have been really well done about considering the link. I know that point's been driven home. I'm sure you all have gotten that sense over the course of the series. And I just hope that from a professional standpoint, I hope that we get the opportunity to continue to collaborate with you all. I love to hear from medical colleagues. I love to be able to reach out and discuss things because there is that integral link between the oral health and systemic health. And I hope that we can continue to collaborate and keep developing this culture of being able to collaborate more often. I've shared my contact information during my presentation back in December, but if any of you wanted to collaborate on a case or want to send over a picture of the gingiva or an x-ray or anything like that, I'm more than happy to collaborate with anybody on a case. So feel free to reach out anytime. Thank you.
That's great.
Perfect. Melody, and then we'll close out with Ernest.
Okay, yeah, this has been a really interesting journey. Hearing from all the dental people, it really hits home, especially like in a rural clinic where you might not have dental access, how important what we do as primary care providers in terms of, instead of saying, open, let me look at your throat, we go, oh, let's start with your lips and work our way in, right? So it just becomes really important. And if you're seeing pregnant women, that's where we've got to start, I think, right? Because if we raise those kids in our practices from before they're born, we're going to have a whole generation of kids who have healthy mouths. And I think that becomes really important when you're out, especially when you're out in the middle of nowhere. There's no fluoride. There's a lot of nothing, no dentists, that if we can make prevention a really big, important piece in our practices, I think that'll go a long way.
Thank you. And Ernest, take it away.
So just thanks. It's been an honor to be part of this group, and I've learned so much from my fellow panelists and our guest speakers, and it's been a great opportunity. And just thanks for everyone who's joined. I don't know that I have any pearls to offer, but I will say, we've often heard that the eyes are a window to the soul, and I think it can be said that the mouth is truly a window in a sense to the health of the body, and it's constantly telling us things about how healthy or how unhealthy we may be or our patients may be. So just an encouragement to constantly listen to what the mouth and just thanks for the opportunity. So great job, everyone.